Hi, I'm Chris Comans from Skin ChX Subiaco. Just going to give you a little bit of education about some of the most common forms of skin cancer we have in Australia, and they're called the keratinocyte cancers. They used to be called non-melanoma skin cancers. That means they come in the form of basal cell carcinoma and squamous cell carcinoma. So how do these form? Well, when I'm doing Skin ChX, I like to talk about heritage. So I ask about heritage because that helps me sort of gather some information about skin cancer risk. So if we talk about Fitzpatrick skin type 1 and 2, often English, Irish, Scottish kind of heritage, that gives me an indication that we're at a high risk of having a skin cancer, most commonly the keratinocyte cancers. So to give you an idea, I'm a Fitzpatrick skin type 2, high risk of having a keratinocyte cancer. And let's talk about how they form. So we know, all growing up as Aussie kids in the Aussie sun, we have these fit, healthy outdoor lifestyles. That often involves a bit of sunburning. That sunburning comes when we're, sometimes not well prepared for the day, and so we get a little bit too much sun and we get that sunburn. That sunburn causes the DNA damage. It takes a long time to replicate, and so average age to get a keratinocyte cancer is around 55. So all that sunburning that we've had since children takes a little while for that DNA damage, because that causes that DNA damage. It takes a little while to replicate, and so by the time we start getting to around 55, that's the average age for having one of those types of skin cancers. Now I do find those skin cancers a little bit earlier on the outdoor cruise, people that are getting a lot of occupational exposure. So occupationally they're getting a lot of sun, but then also sometimes those outdoor crews get a lot of recreational sun exposure. So outdoors working outside, but then on the weekends fishing and surfing and those types of outdoor activities as well, on top of their everyday work exposure. So in those instances, sometimes I find those keratinocyte cancers a little bit earlier, 40, maybe even 36 is not unheard of. Generally before that time we don't commonly see them appear on the skin. So when I see a 20-year-old, I kind of say we're still in our DNA damage accumulation phase, so making sure we're not getting the sun burning, covering up and doing all those, wearing the sunglasses, wearing long shirts, putting the sunscreen when you can't seek shade, wear the hats, etc. So come and see me, get your skin checked if you're worried about having a skin cancer, or finding these things earlier is the most important way to have them treated successfully. So if you get a keratinocyte cancer, a basal cell on your nose, or a squamous cell growing on your leg or your arm, but when you find those things early, the best treatment outcomes. So come and see me if you want to have your skin checked. Come to Skin ChX Subiaco, located conveniently in Crossway Shopping Centre on the first floor. Make an appointment. I'd love to see you. See you soon.